It usually begins with nothing. No pain. No obvious discomfort. Just a normal day, until suddenly, it isn't. A pounding in the chest, a dizzy spell that comes out of nowhere, or a breath you can't quite catch. For millions around the world, this is how high blood pressure reveals itself, not with a dramatic entrance, but with a quiet ambush. The truth is, high blood pressure doesn't wait until you're ready. It doesn't care if you're healthy, young at heart, or feel completely fine. It works in silence, damaging your arteries, burdening your heart, weakening your brain, every single day, without you even realizing it. That's why it's called the silent killer. But here's something most people don't know: long before a crisis strikes, your body tries to speak up. It gives you signs. Not the kind that scream, but the kind that whisper, subtle, confusing, often mistaken for stress, fatigue, or just getting older. The danger isn't just in the symptoms themselves. The danger is in ignoring them. So in this video, we're going to slow things down. We're going to pay attention. Because hidden inside your body may be one of 13 early warnings that your blood pressure is out of control, and you may not even know it. These are real, research-backed, and potentially life-saving signals that most people overlook. And the final symptom we'll reveal? It's the most dismissed, yet one of the most critical. If you value your health, or the health of someone you love, this may be the most important video you watch this year. So let's begin. Because the earlier you recognize the signs, the more power you have to prevent the damage before it's too late. 1. Numbness or weakness in the limbs. Let's begin with a symptom that's often considered a late warning sign but is crucial to detect early: numbness or weakness in the limbs. Elevated blood pressure can silently damage your arteries over time. This damage can lead to serious health issues, including numbness or weakness in your limbs. When blood pressure spikes suddenly, it can cause a hypertensive crisis. During such events, the excessive force of blood flow can damage blood vessels in the brain, leading to a stroke. A stroke occurs when the brain's blood supply is interrupted, causing brain cells to die. This damage often results in sudden numbness or weakness, especially on one side of the body, affecting the face, arm, or leg. The American Heart Association emphasizes that if you experience these symptoms, it's crucial to seek emergency medical attention immediately. In some cases, severe hypertension can lead to a condition called intracranial hypertension, where increased pressure within the skull affects brain function. This elevated pressure can compress nerve pathways, leading to symptoms like weakness and loss of reflexes. A study published in the Journal of Neurology, Neurosurgery, and Psychiatry discussed cases where patients with intracranial hypertension experienced such neurological deficits. The study suggests that the increased pressure may cause nerve root compression, leading to these symptoms. It's important to note that while high blood pressure can contribute to these symptoms, other conditions can also cause numbness or weakness in the limbs. Therefore, regular monitoring and management of your blood pressure are essential to reduce the risk of such complications. 2. Facial flushing. Next, let's talk about a sign you might notice in social settings: facial flushing, especially after alcohol. Imagine enjoying a drink with friends and suddenly your face turns warm and red. This reaction, known as facial flushing, isn't just a cosmetic concern. It can signal how your body processes alcohol and its impact on blood pressure. When you consume alcohol, your body breaks it down into a substance called acetaldehyde. For many East Asians, a genetic variation slows the breakdown of acetaldehyde, leading to its buildup. This accumulation causes blood vessels in the face to widen, resulting in that familiar redness. But there's more to it. This same genetic trait has been linked to a higher risk of developing high blood pressure. A study published in the Journal of Clinical Hypertension in 2022 examined this connection. Researchers analyzed data from over 118,000 South Korean adults and found that individuals who began experiencing facial flushing after drinking had a 42% higher chance of developing hypertension compared to non-drinkers. This suggests that if you notice new flushing reactions, it might be a sign to monitor your blood pressure more closely. It's essential to pay attention to your body's signals. If you experience facial flushing when drinking, consider discussing it with a healthcare professional, as it could be an early indicator of how your body responds to alcohol and its potential effects on your blood pressure. 3. Tremors or muscle trembling. Moving on, let's discuss an early physical signal you might feel but not immediately associate with your heart: tremors or muscle trembling. It's intriguing to consider how our body's internal signals can manifest as physical symptoms. One such example is the relationship between elevated blood pressure and muscle tremors. When blood pressure rises, it can trigger an overactive response in the sympathetic nervous system, the part responsible for our fight or flight reactions. This heightened activity can lead to the release of stress hormones like adrenaline, which in turn may cause muscles to contract involuntarily, resulting in tremors or shaking. A study published in the Journal of Hypertension in 2016 sheds light on this connection. Researchers observed 715 adults without prior hypertension and measured their hand tremors using a laser pointer technique over a median follow-up of 6.4 years. They found that participants with more pronounced tremors had a higher risk of developing hypertension. This suggests that noticeable hand tremors might be an early indicator of elevated blood pressure. It's essential to recognize that while tremors can be linked to high blood pressure, they might also stem from other factors such as certain medications or neurological conditions. If you notice persistent or unexplained tremors, it's a good idea to consult a healthcare professional. They can help determine the underlying cause and guide you toward appropriate care. 4. Tonitis. Now let's explore something that might ring true, literally. Tonitis, or ringing in the ears, can be more than just an annoyance. Hearing a persistent ringing or buzzing in your ears? This sensation, known as tinnitus, can sometimes be linked to high blood pressure. When blood pressure is elevated, it can strain the delicate blood vessels in your inner ear. This strain may disrupt normal blood flow, leading to the perception of noise or ringing sounds. Interestingly, a study published in Frontiers in Neurology in 2022 found that individuals with hypertension had higher rates of tinnitus compared to those with normal blood pressure. The researchers suggested that managing blood pressure could be a key factor in reducing tinnitus symptoms. It's also worth noting that certain medications prescribed for high blood pressure might contribute to tinnitus. For instance, some diuretics and aspirin commonly used to manage hypertension have been associated with ringing in the ears. If you've noticed tinnitus after starting a new medication, it's important to discuss this with your healthcare provider. Managing stress is another crucial aspect, as stress can elevate blood pressure and, in turn, exacerbate tinnitus. Incorporating relaxation techniques such as deep breathing exercises or meditation into your daily routine may help alleviate both high blood pressure and tinnitus symptoms. Remember, if you're experiencing persistent tinnitus, it's essential to consult with a healthcare professional. They can help determine the underlying cause and recommend appropriate treatment options tailored to your needs. 5. Heart palpitations. Next, let's address a symptom that can feel quite alarming: heart palpitations. Elevated blood pressure can sometimes lead to sensations of a racing or fluttering heartbeat, known as heart palpitations. This occurs because high blood pressure can cause changes in the heart's structure and function, such as left ventricular hypertrophy, which may disrupt the heart's normal electrical signals and lead to irregular heartbeats. A study published in the Journal of the American Heart Association in 2020 found that intensive blood pressure control significantly reduced the incidence of atrial fibrillation, a common type of arrhythmia that often causes palpitations. This suggests that managing blood pressure effectively can help prevent irregular heart rhythms. It's important to note that while palpitations can be associated with high blood pressure, they can also result from other factors such as stress, caffeine intake, or underlying heart conditions. If you're experiencing frequent or severe palpitations, it's advisable to consult a healthcare professional for a thorough evaluation. 6. Nausea or vomiting. Let's take a closer look at a symptom that often slips under the radar but may point to a serious underlying issue: nausea or vomiting. While we typically associate these sensations with digestive problems or infections, they can also be a warning sign that your blood pressure has climbed into a dangerous range. When blood pressure rises to extremely high levels, it can affect the brain itself, leading to a condition called hypertensive encephalopathy. In this state, the brain's area postrema, responsible for detecting toxins and triggering the vomiting reflex, can become overstimulated by the excessive pressure. The result? Sudden, unexplained waves of nausea or episodes of vomiting. A 2023 study published in the Journal of Clinical Medicine found that nausea and vomiting were frequently reported among patients undergoing a hypertensive crisis. This finding emphasizes the need to treat these symptoms with the seriousness they deserve, especially when they're not accompanied by digestive issues, but rather appear alongside headaches, blurred vision, or mental confusion. It's important to recognize that while nausea and vomiting can have many causes, when they occur in the context of other neurological signs, they may be your body's way of sounding the alarm. Don't wait it out. If these symptoms strike without clear reason, especially if you have a history of high blood pressure, seek medical help immediately. Early intervention can make all the difference in preventing a dangerous escalation. 7. Fatigue or confusion. Now let's move on to symptoms that can be subtle but serious: fatigue or confusion. Experiencing fatigue or confusion? These could be signs of high blood pressure, even if you feel fine otherwise. High blood pressure can damage your heart and kidneys, leading to tiredness. When your heart struggles to pump blood efficiently, your body doesn't get the oxygen it needs, making you feel worn out. Kidney issues from high blood pressure can also cause fatigue. According to Healthline, fatigue can be a symptom of heart or kidney damage resulting from high blood pressure. Confusion is another concern. Severely high blood pressure can lead to hypertensive encephalopathy. This swelling can cause confusion, headaches, and even seizures. The Cleveland Clinic notes that hypertensive encephalopathy is a medical emergency and can be life-threatening, with common symptoms including headache, restlessness, confusion, and seizures. Recent research highlights the connection between high blood pressure and cognitive decline. A study published in Hypertension in 2024 found that hypertension contributes to cognitive decline through vascular damage and inflammation, leading to brain atrophy. It's essential to monitor your blood pressure regularly. If you're feeling unusually tired or confused, don't ignore it. Consult a healthcare professional to check your blood pressure and discuss any symptoms. Early detection and management can make a significant difference in your health. 8. Nosebleeds. Now let's examine a symptom that many people brush off as harmless, but it may carry a deeper warning: nosebleeds. While high blood pressure isn't usually the root cause of nosebleeds, there's growing evidence of a meaningful connection. Studies have found that individuals living with hypertension are more likely to experience nosebleeds that are either more frequent or more severe. One notable study published in JAMA Otolaryngology, Head and Neck Surgery in 2020 revealed that patients with elevated blood pressure faced a significantly higher risk of nosebleeds requiring emergency medical care. Why does this happen? The blood vessels lining the nasal passages are incredibly delicate. When blood pressure rises, these tiny vessels are subjected to greater force, making them more vulnerable to rupture. Although hypertension doesn't directly trigger a nosebleed, it weakens the vessel walls just enough to make bleeding more likely, and once bleeding starts, the elevated pressure can make it harder to stop. It's important to understand that this isn't a one-size-fits-all symptom. Not everyone with high blood pressure will get nosebleeds, and not all nosebleeds are caused by hypertension. But if you've been experiencing recurrent or intense nosebleeds without an obvious cause, don't ignore it. It could be your body's subtle way of signaling that your blood pressure needs attention. A simple conversation with your healthcare provider and a quick blood pressure check could give you the clarity and the control you need. 9. Chest pain or discomfort. Now let's talk about one of the more alarming symptoms, chest pain or discomfort. Experiencing chest pain can be alarming, and it's important to understand how high blood pressure might be a contributing factor. When blood pressure is consistently elevated, it forces the heart to work harder to pump blood. This increased workload can lead to the thickening of the heart muscle, particularly the left ventricle, a condition known as left ventricular hypertrophy. As the heart muscle thickens, it requires more oxygen. If the oxygen supply doesn't meet this heightened demand, it can result in chest pain, commonly referred to as angina. Moreover, high blood pressure can cause damage to the inner lining of arteries, leading to atherosclerosis, a buildup of plaque that narrows and stiffens the arteries. This narrowing restricts blood flow to the heart muscle, further contributing to chest discomfort or pain. Interestingly, a study published in Pain Reports in 2019 found that individuals with lower systolic blood pressure reported higher chest pain scores during acute myocardial infarction compared to those with higher systolic readings. This suggests that blood pressure levels can influence the perception and intensity of chest pain. It's also worth noting that high blood pressure doesn't always present noticeable symptoms. Regular monitoring and management are crucial to prevent complications like chest pain and more severe cardiovascular events. If you're experiencing persistent or severe chest discomfort, it's essential to seek medical attention promptly. 10. Shortness of breath. Let's now turn our attention to a symptom that reveals just how deeply high blood pressure can affect both the heart and the lungs: shortness of breath. When your blood pressure remains elevated over time, it places an enormous burden on your heart. To cope, the heart's left ventricle, the chamber responsible for pumping blood to the rest of your body, begins to thicken. This condition, known as left ventricular hypertrophy, may sound like a sign of strength, but in reality, it weakens the heart's flexibility. A thickened, stiff ventricle can no longer pump blood as efficiently, and as pressure builds, fluid begins to back up, eventually spilling into the lungs. This leads to a condition called pulmonary edema, where fluid fills the air spaces in the lungs, making breathing increasingly difficult. In some cases, this process happens gradually. In others, it strikes like lightning. A sudden surge in blood pressure can flood the pulmonary capillaries with force they're not built to withstand, resulting in acute pulmonary edema, a medical emergency marked by sudden, severe breathlessness. A 2023 study in the Journal of the American Heart Association found that pulmonary edema was the second most frequent complication in patients undergoing hypertensive crisis, just behind ischemic stroke. This underscores just how directly high blood pressure can affect your ability to breathe. If you've noticed yourself becoming winded during basic activities, like climbing stairs, walking short distances, or even lying down, it could be more than age or fatigue. Persistent shortness of breath deserves serious attention. Monitor your blood pressure regularly, and if breathlessness becomes part of your daily life, speak with a healthcare provider. It may be your body's way of telling you that your heart is struggling under pressure. 11. Blurred or double vision. Now let's turn our attention to your eyes, specifically, vision changes. When blood pressure remains elevated over time, it can damage the delicate blood vessels in your eyes, leading to vision problems. This condition, known as hypertensive retinopathy, occurs because high blood pressure causes the retinal arteries to narrow and harden, reducing blood flow to the retina, the part of your eye responsible for capturing visual information. As a result, you might experience blurred or double vision. In severe cases, high blood pressure can lead to swelling of the optic nerve, a condition called optic neuropathy. This swelling disrupts the transmission of visual signals from your eyes to your brain, further contributing to vision disturbances. The American Heart Association highlights that blocked blood flow from hypertension can damage the optic nerve, potentially causing vision loss. A study published in the Journal of Human Hypertension in 2023 examined the impact of chronic hypertension on retinal health. Researchers found that prolonged high blood pressure leads to significant changes in retinal blood vessels, such as arterial narrowing and arteriovenous nicking. These alterations were strongly associated with an increased risk of vision problems, including blurred and double vision. The study emphasizes the importance of regular blood pressure monitoring and management to prevent such ocular complications. It's crucial to manage your blood pressure through lifestyle changes and, if necessary, medication. Regular eye examinations can also help detect early signs of hypertensive retinopathy, allowing for timely intervention to protect your vision. 12. Dizziness or lightheadedness. As we near the end, let's not forget about dizziness or lightheadedness, a symptom often brushed aside. Experiencing dizziness or lightheadedness can be unsettling, and it's important to understand how high blood pressure might play a role. When blood pressure rises significantly, it can damage and narrow the blood vessels, reducing blood flow to vital organs, including the brain. This diminished cerebral circulation can lead to feelings of unsteadiness or faintness. A study published in the Journal of the American Heart Association in 2020 highlighted that orthostatic hypertension, a condition where blood pressure increases upon standing, is linked to dizziness. Researchers found that this blood pressure spike can disrupt the body's normal response to posture changes, leading to reduced blood flow to the brain and subsequent lightheadedness. It's also worth noting that certain blood pressure medications might cause dizziness as a side effect, especially if they lower blood pressure too quickly. If you're experiencing persistent dizziness, it's essential to consult with a healthcare professional to determine the underlying cause and appropriate treatment. 13. Headaches. Finally, let's circle back to the very first warning sign we discussed: headaches. Experiencing a throbbing headache? It might be more than just stress. High blood pressure, or hypertension, can sometimes manifest as severe headaches, especially when blood pressure spikes suddenly. When blood pressure rises rapidly, it can increase pressure inside the skull, leading to intense headaches. This happens because the elevated pressure forces fluid into the brain tissue, causing swelling and pain. Such headaches often come with other symptoms like confusion, vision changes, or nausea. A study published in the Journal of Headache and Pain in 2024 highlighted this connection. Researchers found that individuals with high diastolic blood pressure had a slightly higher risk of experiencing migraines. This suggests that managing blood pressure could be key in reducing certain types of headaches. It's important to note that not everyone with high blood pressure will experience headaches. However, if you frequently have severe headaches, it's wise to monitor your blood pressure and consult with a healthcare professional. Early detection and management of hypertension can prevent more serious complications down the road. Remember, your health is in your hands. Regular checkups and being attentive to your body's signals can make a significant difference. Your body is wiser than you think. Long before disaster strikes, it sends quiet signals, hoping you'll notice, hoping you'll act. High blood pressure doesn't have to end in crisis. With the right knowledge, attention, and care, it can be managed, and even reversed. The power is in your hands, and it begins with awareness. If even one of the signs we shared today sounded familiar, don't wait. Talk to your doctor. Make a change. Take your health seriously, because no one else can do it for you. And if this video helped you understand your body a little better, or gave you a reason to check on someone you love, then let it be the first of many steps. We're here to keep you informed, supported, and strong, so don't forget to subscribe to this channel for more trusted, life-saving health content. Hit the like button, share this video with someone who needs it, and turn on notifications so you never miss what could be the most important advice of your life. Stay aware. Stay strong. And as always, take care of yourself. We'll see you in the next video.